A very popular birth control method is referred to as the morning after pill. This is really an emergency contraceptive. Emergency in the sense that the woman would have had sex before and then afterwards seek methods to prevent a pregnancy. The morning after pill is widely used, and a lot of times though the people may not necessarily know the proper way to use the morning after pill. For example, the morning after pill consists of 2 doses. One should be taken, or the first dose should be taken 72 hours or within 72 hours of sexual intercourse, and the second one taken 12 hours after the first one. A lot of times, I suppose, why this method may not work is because it's not taken properly. One, it may be taken later than that 72-hour period, or secondly, they may sometimes miss that second dose, and therefore the results may not be as would have been expected. My advice though is that if you're taking the morning after pill, the earlier it is taken to the actual moment of sexual intercourse, it's the better chance for it to work. So as close to that moment as possible, and you would have a better outcome if you're using that method. There's another consideration as well when someone is taking the morning after pill. One of them is that you have to recognize that your normal regular period will come, or usually will come, earlier than it usually does. And in fact, when you take that pill, it's not unusual for 4, 5, even 6 days later, your menstrual period will appear, and that is to be expected. As a matter of fact, you could perhaps say, if the pill really works, you most likely will have a period that will follow. Another consideration as well is that this is really a temporary type of birth control. It's an emergency method, and you cannot, or you should not use it more than 4 times in any 1 month. If it is used too often, it will cause your cycle to become very irregular and unpredictable, and you just will not know where exactly you are in your cycle. You'll have irregular spotting and bleeding if it is used too often. So a maximum of 4 times in any 1 month as a temporary form of birth control. If it's not taken properly, the greatest risk, I suppose, is that it just will not work, and your period will not come, and you go and have a pregnancy test done, and that test will be positive because the method has failed.